ribavirin for chronic hepatitis E virus infection in transplant recipients and immunotherapy in renal cell carcinoma. Definitions: hepatitis E virus is an icosahedral non-beloved single-strain RNA virus that is approximately 27 to 34 mm in diameter. It has been classified as the single member of the genus Herpesvirus in the family Herpesviridae. The antiviral drug ribavirin can clear chronic hepatitis E virus in solid organ transplant recipients, research report.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently, or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register.
Application in medicine. HEV infections is usually self-limiting except in patients with a suppressed immune system, where it can involve to chronic hepatitis and cirrhosis. Heparin is a general antiviral that invites replication of many RNA and DNA virus. It has long been used 3D to treat hepatitis C, along with pegylated interferon alpha and now several direct-acting anti-ACV agents. Cons: ribavirin is a safe treatment option for AEV infections. However, the optimal dose of ribavirin for the treatment of the chronic hepatitis E remains to be determined as treatment failure may occur.
Hey, thank you for watching Medicosis Perfect. It causes jaundice in the Far East, Egypt, and by Egypt I mean undercooked seafood, which can lead to failure. Ew. And there is marked cholestasis and hepatitis E, mostly including Harris, and these go together. Anyways, so that's it. Now you know everything you need to know about hepatitis E. But wait, there is more. And now, question of the day. Which type of hepatitis is the most commonly associated with sexual exposure? Is it Hep A, Hep B, or Hep C? By the way, if you go to my Facebook page, there's an album there, contains all of the questions. This is the fourth question, so if you need to get them all, go to my Facebook page. Now, you know all you need to know about Hep E. Please go ahead and enjoy the rest of the day, and I'll see you later. Thank you very much.
The other pathology definitions: renal cell carcinoma is a third type of urologic cancer and has a poor prognosis with 13% of metastatic patients at diagnosis. The antiangiogenics and target immunotherapies led to treatment remodeling, emphasizing the role of the tumor microenvironment. However, long-term responses are rare with a high rate of resistance. New strategies are emerging to improve the efficacy, and the emerging routes are under evaluation in ongoing trials. With the different treatment options, there is an urgent need to identify biomarkers in order to predict the efficacy of drugs and to better stratify patients. Applications in medicine. The treatment and management of metastatic RCC have radically changed over the past 20 years. Initially, first generation immunotherapy with cytokinins, interleukins, or interferon represent a standard approach, but with poor results. The development of tyrosine kinase inhibitors, medullobascular endothelial growth factor, VEGF receptors inhibitors largely improve the prognosis of both progression-free survival (PFS) and overall survival (OS).
The combination in immunotherapy are focused on the first line, and clearly it's the future. It's already the standard treatment with double IO, IO TKI. But the main point, we have two challenges. First, we have to know how to select the good combination for the good treatment for the good patient. And we have IO or IO TKI, and we don't really know. We need biomarkers to identify a patient who will derive any benefit from this combination. And in order to identify this kind of biomarker, we launched in France a randomized phase 2 trial called Bionic, and we select patients based on molecular groups defined on frozen tumor samples, and based on these molecular groups we allocated treatment double IO nivolumab ipilimumab, and to show the first result, I think, at the end of the year at ESMO Congress, and we will see if we can turn, of course, and
Pros. Identifying biomarkers is the key to better select treatments, reduce costs, and improve survival in patients with metastatic kidney cancer. However, the limitations of the most studied biomarkers, PD-L1 immunohistochemistry to TMB make necessary the identification of robust markers. New technologies could help in this purpose. Cons. The sarcomatoid component can be found in all the histologic subtypes and demonstrates an increased tumor mutations burden TMB with high frequency of P16 third CDKN2AN and F2 mutations and also genes involved the chromatin remodeling such as ARID1 and BAP1.
With the VEGF TKIs, new standards of care.
It should play applied in Ecuador. The most common carcinoma in the different subtypes of kidney cancer is clear cell. Among the most important acquired risk factors such as tobacco or being overweight in Ecuador and additions to hereditary predisposition. Since this is a ceiling tumor, the specific treatment, total or partial nephrectomy, is today the only current treatment for kidney cancer. In recent years, research and advance in molecular biology allow us to know which pathways are altered in this tumor and to design drugs directed against proteins abnormally expressed in these pathways that have achieved an important advance in survival for metastatic patients.
So it really, as I was mentioning, has been transformative for the care of patients with advanced RCC, and it's not sort of a new therapy either. We think of immune therapy in kidney cancer, and it's not that combination with other drugs has really led to dramatic responses in a number of patients. I think what's most exciting is it's not only that more patients are responding and more patients are living longer, that's tremendously important, but that we're seeing, hopefully starting to see at least a tail of the curve, meaning that some of these patients really do seem like they have long-term or durable responses. And so the hope is not just to get better and better treatments, but actually to try to get to a point where we're having a lot more long-term survivors with kidney cancer. And the ultimate goal is cure and getting towards that goal for more and more people.
Conclusion: renal cell carcinoma include distinct entities with specific molecular alterations. Among them, ccRCC, the most frequent, is particularly characterized by its immunogenic and immunogenic TM8 with complete interactions between stromal and immune cells, like tumor cells. Intratumor heterogeneity is present in the TM8 with a variable distributions and phenotypes and consequently favors resistance to treatment. Therapeutic options for patients with MRCC have expanded rapidly over the past decade, with targeted immunotherapy being the new cornerstone. Several emerging drugs are designed to enhance the antitumor immune response and are tested in ongoing trials. Thank you for the donations.